What does it mean if your EKG says you have left ventricular hypertrophy? So it's important to remember that the EKG can be anywhere from 70 to 90% accurate for picking up on left ventricular hypertrophy. And that's because everyone has a different amount of fat tissue, muscle tissue, breast tissue, and even lung tissue. And that's all in the same area as the heart. And so the EKG reading can change based on that, as well as the lead placements on your chest. And then some people normally have changes that can be read by the EKG machine as left ventricular hypertrophy, but is actually normal. And that can be more common in younger people and people who are extremely athletic. Those EKG changes can show up. And so, if it's relevant to you, then a lot of times you would have another test to see if you do have left ventricular hypertrophy. And that usually for most people is going to be an echocardiogram because that's what's most likely to be covered by your insurance, but it could also be cardiac MRI or CT or another imaging test, but it's usually going to be an echocardiogram. And that would actually measure the walls of your heart. Left ventricular hypertrophy means that the walls of your heart have become thicker than what is considered the normal range. And so that's what an imaging test would actually look at the walls of your heart and make those measurements and see if you do, in fact, have thicker walls than what is in the normal range. And the reason you would want to know is then you would want to do things to make sure that you don't have high blood pressure or you're controlling high blood pressure. You would want to do those things anyways, but they can make the left ventricular hypertrophy worse. Blood pressure control is one of the main things to manage left ventricular hypertrophy from getting worse. And so you would want to know something like that if you actually have it or not, so you can be monitored for high blood pressure and other health conditions that could impact your heart. If left ventricular hypertrophy gets much worse, then you can even have, unfortunately, abnormal heart rhythms and heart failure and things like that. And so that's why you would want to make sure if you did have it that you were doing all the things to prevent it from getting worse that you are able to do.